Hi, Scott Walker here for the One Foundation with the Myrna Brin Center of Integrative Medicine at Jefferson, and so privileged to be talking to the heart and soul, the sweetness of the whole center, and that is one magnificent Anna Tobia. Dr. Tobia, nice to see you.
It's so wonderful to be here, Scott.
We're going to have a little fun.
I think so.
You know why? One of the reasons that I'm here is I wanted to talk about the study that you were such an essential part of, outside of the patients. You were taking care of the patients that participated in the study, and there's so many things I want to talk to you about. But let's stick with the study itself right now. Well, first of all, let's start with how did you get introduced to NET, and then how did you get introduced to the study? And I think that'll be the logical course. So
Okay,
go ahead. So
great.
how'd you get introduced to Neuro Emotional Technique and the study?
Well, when I actually was doing my postdoctoral fellowship in health psychology, my mom had experienced NET from a local doctor.
Is that right?
Yep,
I
and
didn't
so
know that.
yeah, and she said, "I tried this thing, and it is so weird. You have got to find out what this is." And I said, "I thought, oh, what is my mother doing?" Right? What has she found? And so I went to a workshop. She convinced me to go, and it was the one with Candace Pert. So that was my first workshop in DC. And I saw it and I thought, this is amazing. This is revolutionary. Nothing I have learned in my years and years of schooling has been anywhere near as efficient and effective as what I saw up on that stage. I was moved beyond words. It actually brought tears to my eyes when I saw the muscle testing and how efficient and quick it is at getting to the heart of a problem, and then how immediate the resolution is. And I was determined that I would do this. And I went back to my office and I never did it again. And then I took another workshop and I came back just as determined. And I actually tried it with a few people, and it went terribly wrong because I had messed up the steps and I wasn't sure what I was doing. But the people actually said they felt better, even though I'm sure I did it completely wrong. And then I went and I did a success in Montana. And after that, I have used it with, I would say 100% of my patients, but maybe there was one or two who came in for something else, but I use it all the time, all day, and I love it. It is so effective. People love the response. They feel better in the first session, as opposed to years of psychotherapy to feel maybe I changed, maybe something got better, but they're not really sure. This is effective. People feel better. And what I love is that all the areas of their lives change. Even if you're working on one discrete problem, other things get better as their physiology improves using NET.
You were trained as a traditional psychologist.
Yep, as a medical psychologist. What that means is I was trained in the connection between physical problems and illnesses, like like heart disease, cancer, diabetes, and how that impacts us psychologically. How the interplay between being sick chronically for years or having an acute illness, how that can affect the way we feel about the world and ourselves, and how that impacts our understanding of ourselves.
Well, let me ask you a question. Is it psychosomatic or somatopsychic? What were you, traditionally, you were trained in psychosomatic medicine?
I would say that the problem is psychosomatic has a negative connotation, as if people are sort of making up their conditions.
Yes.
And that was not what I was trained in. What I was trained in is that there's a really unique combination, that we're not just floating heads, that the mind and the body are connected.
Yes.
And that when we have physical illnesses, it takes an impact on us emotionally. And likewise, when we're having emotional stress, it can impact us physically. And so that's why it led so well into NET. I mean, it's absolutely the perfect training to then go into this. And then that's how I got involved in the study. As I lived in Philadelphia. My family was from Philadelphia. And so I found Dr. Monty with Candace Pert, and I introduced myself to him when I was there. And then we got to talking, and then slowly he brought me over to the center when I finished my postdoctoral fellowship, and then I've been here ever since.
And then the study came up, and you were picked. You have to take care of the patients.
I was.
And how did they bring it up to you?
Well, Dr. Monty and I had a discussion about the study and moving forward with this study and how important it was. And I knew immediately that I wanted to be a part of it. and that I really wanted to be able to show how effective NET is. I think this is just one of the most important studies because this treatment really changes people's lives, and it does it quickly, and it does it like nothing else. And so I felt like if we could document this and show people what I've seen in my practice for the past decade or more, that this really works.
And so you were getting the idea that there were going to be functional MRIs done before and after. And do you know that you actually saw some of the functional MRIs before and after? And you were the first NET practitioner in the world who has ever seen that.
I got to see inside my patient's brain
That's
and to
right.
see how it changes with this technique. That changed the way I do NET.
Oh, it did?
It did, because you know what? I feel a new sense of confidence, which is what I'd like to instill in the people watching this video, that it really works. And what was most amazing is their brains changed very quickly in just 3 to 5 sessions. Many of them, right at 3 or 4 sessions, felt significantly better, and their brains were completely different.
Boy, there's a big area about patient subjectivity and how they change through the day and the moods that they go in and out of, and how they're accurate they are in reporting things. There's those many studies done on that, and it's all over the map. Patients can't hold all that in there, but so you can stay the course. You could say, no, the keel's in the water, we're going the right direction, just come along with me here, and it helps you with patient management, actually.
Absolutely.
Your confidence.
Yes.
Is that right?
Yes.
That is so awesome to. And so the images that Dr. Newberg showed you.
I just felt so good for the patients. You know, you just feel this sense, this surge of gratitude that I have this technique. Like, I felt so grateful to my mother that she brought me into this.
Oh, yeah,
you know,
Mom.
that I found this, that there are so many other techniques out there that I could have stumbled upon and, had lost my way, but I didn't. I had this, and I just feel so grateful when I see it. Their brains are so hot, and then they're completely still. It's just there's normal activity after the treatment. What they found is that there's an increased connection between the part of the brain that helps us calm down and process emotion and the emotional center. And so what happened before, when they're so stressed, when they've had this terrible trauma like cancer, that it overstimulates the brain so that the brain can't calm itself down, so that other things that shouldn't be stressful are now more stressful as well. So the volume is turned up very high. And so what NET does is it turns down that volume so that the brain can process information more accurately. And so it's no longer as stressed. And so what I found is that it's like before the connection was very poor. Like if you think of dial-up, right? Like it was staticky. Yeah. They weren't getting the message to calm down, that it's going to be okay, that I survived the cancer, right? So some of these patients, when they came in with their script, they may have happened 4 or 5 years ago, but they were still living as if they were dying of cancer.